hundreds of deaths recorded in Kano in the last couple of days, including increasing cases of the COVID-19, there has been a backlash against the state government, which has been accused of not doing enough to contain the situation. The Kano state government has now responded to the outcry, stating that the recent deaths are not connected to COVID-19 pandemic. In a statement released, the State Commissioner for Information, Mohammed Garba, said most of the deaths were caused by complications arising from hypertension, diabetes, meningitis, and acute malaria. He further stated that Governor Abdullahi Umar Ganduje is earnestly waiting for the final report from the State Ministry of Health so as to take necessary action. In the meantime, the Kano state government says more measures have been put in place to curtail the spread of the virus. The state now has 77 active cases of COVID-19 and 1 death. Correspondent Ibrahim Issah reports.
Kano has confirmed 4 additional cases of the coronavirus pandemic in the state. With the new cases, the state now has a total of 77 active cases and 1 death. Many residents are not convinced this truly reflects the number of those infected or who have died from the pandemic. Their apprehension is bolstered by the decision of the NCDC to temporarily shut down the state's testing center in the midst of reports of rising cases of the virus. Daily occurrences of mysterious death in the state has further buttressed their suspicions that Kano may be in the center of something big.
I know, yes, previously, even before NCDC came into Kano, there was arrangement for samples to be taken to Lagos and Abuja. But we also cried out and said Kano needed a center, and then for it to abruptly be closed is something that is worrisome.
We are begging the government now to see that they send down the testing machine now, so that we know where we are in this Kano state.
Well, it is bad for 48 hours now. There's no testing and there's no result. And the reason for that is that we heard from the news that there are no equipment that will go for the testing, and even the health workers themselves are even contacting the COVID disease, which is not good. So I feel it's bad.
Both the NCDC and the state government are yet to come up with a satisfactory explanation for the mysterious death, and numbers are rising every day. A list came out on social media over the weekend naming prominent people that had died in Kano in one day. It is yet to be verified, and the NCDC and the state government say they have launched an investigation into the matter.
Well, joining me from Kano is TVC News correspondent Ibrahim Issah. Ibrahim, good morning and thank you for joining us in TVC Breakfast. From the report we are getting, we are told that meningitis, acute malaria, hypertension are the cause of the strange deaths or the rise in death that the state had witnessed in some days back. Talk to us about this. How did we arrive at this point?
Well, actually, there had been outcry by residents, especially on social media, on Twitter. Lots of people talk about Kano, and the attention of the people, the attention of all the people of the nation was back on Kano. Even Lagos couldn't get that attention, the epicenter of COVID-19, with regards to the number of deaths in Kano. Now, yesterday, the government decided to speak on the matter. First of all, to agree that the mysterious deaths occur every day, and then launched a preliminary investigation into the matter, and then revealed that acute malaria, diabetes, hypertension, and ulcer are some of the reasons for those deaths. Yesterday, there were also deaths of some people and who are actually prominent. A professor from mass communication also died yesterday in Kano. So the situation in Kano is worrisome, but it's actually a good news for residents since the government had swung into action by finding out first that those were the reasons for the mysterious death. And I'm sure lots of investigations are also going to be carried out to find out more on the mysterious death.
Now, what did the government talk about how it intends to move from here now to ensure that the citizens do no longer die as a result of all of these illnesses it's mentioned, because there's been some level of accusation from the citizens of the state saying that the government is focusing on, you know, COVID-19 instead of other illnesses in the state.
Well, the government says it has laid down modalities to ensure that that issue is addressed. We know that the government is also putting measures to ensure that the spread of the coronavirus is curtailed. But since the outcry of residents, since the government has begun responding now to the mysterious death, I am sure that the government will also try as much as it can to make life better for its residents.
All right, Ibrahim Issah, we'll definitely get back to you for more updates. Thank you for speaking with us.